Well, in many respects, I think the next presenter comes from an organization that sort of goes with no introduction, at least for me. You know, when we talk about things like IHI or Virginia Mason, I in the same breath think of a Pittsburgh Regional Health Initiative. It's one of those groundbreaking organizations that was way, way ahead of most of the rest of us. So we're very pleased and blessed to have Dr. Feinstein, who is the CEO of the Jewish Healthcare Foundation and Pittsburgh Regional Healthcare Initiative here. They, as I said, a leading early voice in patient safety and healthcare quality in using industrial engineering and lean practices to change healthcare. And so Dr. Feinstein has a bachelor's degree from Brown University, a master's from Boston College, and a PhD from Brandeis. And welcome up, and we're anxious to hear.
Thank you very much.
The clicker is, that's it, green.
Oh, just the green. Okay. Thank you very much. What a wonderful speaker to hear and to follow, and I think very stimulating in terms of the focus on let's not aim for 30% improvement. So I think I'm going to pick up on that theme. What is very funny is the description of what I'm going to talk about in your handouts is somewhat totally contrary to what I'm going to talk about. So that should be interesting, but let me move along, and hopefully it will fit very well. I think it does with the other speakers you've heard today. We're somewhat unique. We don't have a hospital. We don't have a primary care setting, so we have to always work in other people's space. We are a regional healthcare collaborative, regional health improvement collaborative. We're very old in that we were formed in '97 before the Institute of Medicine published To Err is Human, or Crossing the Quality Chasm. So we were one of the early Jeremiahs saying healthcare ain't so great in America. We don't have the best healthcare system in the world. And our message that dramatic improvement and quality was the best cost containment strategy was kind of a weird message in 1997, and so it's been a very interesting journey for us. We went from being the Jeremiahs, now we're kind of running to keep up with the herd, which is terrific. I have to give a lot of credit to Paul O'Neill, who was one of our co-founders. Paul at the time was the CEO of Alcoa, which was the safest corporation in the world, and also one of the highest performing. And I think he added a great deal to the seriousness with which people took our early message. We were a product of the business community. We were formed by a group of corporate leaders in Pittsburgh through their organization called the Allegheny Conference. And so our early message, and we've stuck with this over 15 years, is that right now you are paying 40 cents on every dollar for total waste. None of that money buys any health care for your employees. And what we believe we could produce for you is that every dollar buys value, and you would spend less and get better outcomes. So we looked at the 40 cents, errors, inefficiencies, unnecessary treatments, preventable complications. People ask, where in '97 did you ever get 40 cents? Well, thank you, Malcolm Gladwell. We just kept going up until the CFOs at the hospitals blinked. And the funny thing is, really serious research by the Society of Actuaries, other research by Reuters over the last decade have proven that 40 cents is a pretty good number. We're one of now 40 regional health improvement collaboratives around the U.S. There's one here in Baton Rouge. There are actually two in Maine. We have a network, which we didn't have, obviously, in '97. And each of the stakeholders, each of the coalitions involve a group of stakeholders, multi-stakeholders from the community, trying to improve care, trying to increase the value of care. So one thing that was interesting to us, the problem was worse than we thought in '97. There weren't a lot of data out, and now I think many of you have seen these data, so I won't go into them for very long. The Commonwealth Fund has done a wonderful effort comparing care across developed countries. We are the column on the right. In almost every area we fail. We are twice the cost of per capita for any of the other developed countries, and the ability to give our population long, healthy lives is poor. And then we could go on, but I won't have time. I don't want to use it now. You've heard a lot about waste. Waste is a serious problem. Waste is what we're all here gathered to talk about. People often link it with fraud, and I say, oh, please take it out. Fraud is something different, and fraud is a small contributor to what diminishes the value of the dollars we spend on health care. The one thing that has been so discouraging is we believed once the Institute of Medicine, this isn't the Socialist Labor Party, comes out with a statement about how serious the flaws were in our medical system, there'd be dramatic change. We'd see amazing improvement over the last decade. This is a wonderful study from Milliman. The work was actually done by the Society of Actuaries, and it's just horrible. It's so discouraging. Every one of the conditions there is 90% preventable. The number of conditions go from hundreds of thousands down to tens of thousands, costing us an enormous amount. So the one thing that was interesting, in 2001, the Institute of Medicine said, we can't make incremental change. This is going to take sweeping change to address the flaws in our healthcare system. And interesting, we're now 10 years later,